Dr. Julie Gray here from Piton Physical Therapy on our 7-day journey to better understanding vestibular therapy. So day 6, question 6, will vestibular therapy make me worse? And two-part question, so also how long will it take me to get better? I feel like these are the two toughest questions that everybody wants the answers to. So first, will vestibular therapy make me feel worse? In the long term, no way. Vestibular therapy shows strong evidence in reducing dizziness, decreasing falls, improving balance and gait, and overall quality of life. But clients often approach me with hesitation because when you're dizzy, it's scary. And maybe they have had a bad experience or have heard of somebody who has had a bad experience, or they may have never even heard of vestibular therapy as a solution to their dizziness and motion sensitivity. So depending on your condition, there may be times within your session that your symptoms increase. But this is okay and normal. We work at a specific threshold of your tolerance and adjust according to your symptoms. Now, if you have attended vestibular therapy in the past, but it left you with symptoms being really flared up, you need to see a new provider. Now, not everyone will like what I'm about to say here, but for most people, we will actually need to cause some mild symptoms during your treatment. Now, hear me out, because it's the same reason why you wouldn't go to the gym and expect to lift like a pencil to increase your strength in your arm. It would be too easy. You need to add some weight in your hand in order to build strength and resistance. The same applies for the vestibular system. Unless we are pushing the symptoms, we are not increasing its strength. Now, just like you also wouldn't go to the gym and start day 1 by lifting a 200-pound weight to strengthen your bicep, it's important that we are gradual and we adjust to your tolerance and your symptoms. Otherwise, it's just going to leave you regretting trying exercise in the first place because you'll be too sore, your symptoms will be aggravated, and it'll just be a mess. But by training in gradual doses and increasing the resistance gradually, we are educating your balance system that motion is good and healthy. But by avoiding the tasks that cause symptoms altogether, we're actually weakening our vestibular system. This constant need of push and pull is why it's super important to connect with a trained vestibular therapist to help develop your program to your specific tolerances and symptoms. So the second part of today's question is, how long will it take me to feel better with vestibular therapy? The short answer to this question is, it depends. There are a lot of different factors that can go into this. Clients with some type of vestibular disorders like BPPV typically only require a couple of sessions to return back to totally normal, while other clients who are recovering from something more involved, like maybe a concussion, will require a longer episode of care to develop healthy compensations and achieve appropriate recovery. However, after our thorough evaluation, we will be able to tell you about your condition and our recommended duration of your treatment plan in order to help you achieve your goals and reach your peak potential. So that wraps up day 6. I'm so excited you guys have stuck it out with me for so long. Last up on our 7 most common vestibular questions is, what kind of exercises will I have to do in vestibular therapy? So stay tuned for that tomorrow, and I'll see you then. Bye.